Hello, good evening. My name is John Brady, and I have my staff here with me. I'm the fire chief here at Hickman, Nebraska, in the Hickman Rural Fire Protection District. And I have my assistant chief, Art Robertson, here with me, our fire and EMS captain, Chelsea Brown, and our EMS supply clerk, Julie Tripliotti. Thank you for joining us today. The reason we wanted to touch base with you guys is due to the kind of the peak area for our COVID-19 response. Basically, this video is not to speak about the COVID-19 response. I'm sure that you all have had a tremendous amount of knowledge in this through the news media, through the CDC. Hopefully, if you're not, please go to the CDC and the Department of Health and Human Services and research that. They have a tremendous amount of knowledge in regards to the virus itself. But this video strictly is to let you guys know that the fire department here, the fire and rescue department, is ready and has been training for this for some time. What we want to do today is just explain to you guys how will we respond to each type of call. There will be 3 different responses. We will go over those all today just to let you guys know exactly how it will look. It obviously will look much different than in the past, from a couple of months ago, where you see your neighbor pull up to help you and they look just like your neighbor. Nowadays, unfortunately, that will not happen. Everybody will have our personal protective equipment on. So we just want you guys to understand that and see that, and hopefully that helps our response and you guys understand why we look the way we look and why we're doing what we're doing, okay? First thing we're gonna do is we're gonna talk about basically your initial contact. What you're going to do, like any other call for services, you're going to contact 911. And when you contact 911, you're going to speak to a dispatcher. And due to the COVID response, each dispatcher has a series of questions they need to ask you. They're called pre-screening questions. Okay? These pre-screening questions have one basically cause, and that's just to give EMS responders and law enforcement responders just a very small idea as to what they may or may not be getting into. So what they're going to do is ask you a series of questions, very simple. They're just going to ask you, do you have any shortness of breath currently? Do you have a fever, a sore throat, a cough, or is there anybody else in the house with you that also has those types of symptoms? And then lastly, they're going to ask you if you've been traveling. Have you traveled out of the state or out of the country within a certain time frame? If you answer no to all of those questions, you are what we call a negative screening. Now, as a negative screening, it will be somewhat of a normal call, but our personnel will still be wearing our personal protective equipment, and we'll show you. If you answer yes to any of those questions, you are now what they call a doorway triage. And what that means is our policy, our process will change quite a bit to where we're protecting our staff members as well as you and whoever's in your home at that time. Okay, so we're gonna start. We finished the first process, we talked to our dispatchers. Our dispatchers then give you those pre-screening questions, you answer those questions. The first scenario that we're going to go over is if you answered no to all of those questions, that negative screening process. So what's gonna happen? Very simple. Our response does not change. So they give us a negative screening here at the fire department. Our members are going to come in from wherever they are, whether at their home or at work. They're going to respond to the fire station. When they do so, as a result of the COVID-19, our responders are going to start to begin their PPE or the personal protective equipment process. Okay? These folks will then respond to the address, and one EMT will make contact with you at the door. And this is very important for you guys to understand. Typically, you'll see 3 or 4 of us carrying bags, all prepared to do what we need to do. Well, that's not currently the case, okay? So what one EMT is going to make contact with you at the door. This EMT will have the very basic, probably the minimal amount of personal protective equipment on, and this is just due basically because it's just very difficult to get a hold of this stuff, okay? So the EMT will then show up to the house, they will make contact with you at the door. The EMT will have a face mask on, They will have eye protection on, like glasses, or it could be a shield, just depends. And then they will also have gloves on. That is the basic level of PPE that initial EMT will contact with you at the door on a negative screening. We're going to bring Chelsea in real quick, and she's just going to kind of show you what they'll look like at the door. So as you can see, she has her gloves on, her mask, and her eye protection. This is the basic level that we will see for a negative screening type of call. Thank you, Chelsea. Now, once that happens, the EMT is also going to ask you a series of questions, no different than you probably got by the dispatcher. This is just to make sure we're verifying all the information, or make sure we're verifying anybody else in the house is all good to go, is all a negative screening. So basically, what we are is either we are symptomatic, which means we have one of those types of symptoms going on, you or somebody else in the home, or you are asymptomatic, which means you don't have any of that and nobody else does in the house, okay? So that EMT is gonna go over a form with you, and it's gonna ask you a series of questions. They are also going to conduct vital signs with you. What we ask of you when we arrive, if you are able, we would really, really appreciate you guys meeting us at the door. So if you can walk, if you are in a wheelchair, if you're on crutches, whatever the case may be, we ask that you please meet the EMT at the door so that we can really lower our exposure point at that time, even if it is a negative response. We really just want to avoid going into the homes, avoid possibly exposing our equipment, and then having to replace that, which is extremely expensive. So if you could just meet us at the door. That EMT will then start their process of, again, questioning you in regards to your symptoms and how you're feeling, like any other call would be prior to COVID. But then they're also going to conduct your vital signs at that point. Your vital signs will help us determine exactly what we need to do in regards to your current treatment, okay? Once that happens, then the EMT at the door will then make a decision. His decision or her decision will be, okay, we're good to go here. Nobody else in the family has any symptoms. My patient is not showing any symptoms. We can kind of relax a little bit. We can bring it down, and she or he can bring in some assistance to help them finish that call for service. After that's done, like anything else, we'll load the patient up into the ambulance if it was determined they need to go to the hospital, and then we'll move on for the rest of the call for service. That is the first one. That is a negative screening call. Scenario number two. Scenario number two is when you talk to that dispatcher and you happen to have one of those symptoms that they asked you about in your pre-screening. Whether it was a sore throat, whether it was the cough, if you traveled, if somebody in the house has, or somebody else in the house has the cough. So then we jump into a little bit higher level of protection. So we are going to call that, and the dispatchers will give us a doorway triage code. So en route to your address, they will tell you they want you to conduct a doorway triage. With that being said, the process is the exact same at the beginning. One EMT will show up, they will knock on the door and make contact with you at the door. Again, we ask to please bring the patient, if it is not you, bring the patient to the door so that we can conduct that doorway triage, okay? All of that will be done there. The EMT will look slightly different. If we have a doorway triage, that means you've met this standard. The EMT will look just a little tiny bit different. Julie, if you'll walk up, this is the way the EMT will look in a doorway triage. Julie has a face shield on as opposed to just glasses. She has her mask on, she has her gloves, and she will also be wearing a gown, just like this one, okay? This is what we'll be wearing if there is a potential risk for COVID-19 presence, okay? Thank you, Julie, I appreciate that. And again, we're just showing you this stuff so that you guys understand that the Martians aren't coming to your house. We're wearing, we're wearing suits to protect not only ourselves and our families and when we go home, but you guys as well. So that's what a doorway triage EMT will look like. The process, again, will not change. She will then, or he will then, ask you a series of questions off of a form that was provided to us by the CDC and the Department of Health and Human Services to help determine whether or not a patient not is COVID-19 positive or negative, but if we should decide that that patient needs to either go to the hospital for further treatment or tell them to stay in their home and self-quarantine and contact their doctor immediately. So the EMT will then begin that form process, the same process as the first one. They will take your vital signs, they will check all the boxes, work their way down that sheet. That sheet, once we're done, will tell us exactly what to recommend to the patient. If that patient, for some reason, is non-ambulatory or cannot walk, if that patient is so sick they're in bed, if they're elderly, if they're not mobile at any time, we will gown up a second staff member, an EMT or firefighter, and assist with that process. So we try to keep it to one, but if necessary, we will certainly gown up a second member and continue to call for service. So don't think you have to force somebody to the door. We recommend that. We would appreciate that as much as possible, but that is not the end game. If you cannot get to the door, we certainly will. We will gown up and make this as comfortable for you as possible. So once we complete that sheet's going to tell us two things. One, it's going to tell us this person needs to be seen for higher care at the emergency room, and we will start a transportation process. Okay, if the sheet tells us, yes, this person, due to your vital signs, due to your severity of your cough, whatever the case may be, we are then going to begin our transport process, which will be, we will then suit up another member into our gear, just like you saw with Julie. We will have each and every patient, we will throw a standard surgical mask on the patient, okay? Most people, for the most part, can tolerate a mask like this. There are times where folks cannot. If you cannot tolerate a mask like this, make sure you tell us right away. But we will ask you to put one of these masks on as well. It's just extra coverage for us, as well as our equipment and yourself, okay? If for some reason you're feeling uncomfortable with this, we will also add oxygen for you by using a nasal cannula. We'll throw some oxygen underneath there, and usually, typically, that'll kind of get you over that anxiety hump while these things are on. Thank you. So, I'm sorry. Once we get that transportation idea in our heads, we will then gown up another member, just like you saw Julie. Then they will work in tandem together to get you loaded up and into the ambulance for transport. If our sheet says it is to the point where we recommend a self-triage, stay at home, or it's not triage, excuse me, a self-quarantine. So what happens is if you meet this standard on this form, we're going to ask you to please stay at home. Basically, what we see is a life threat is not present, but you do need to contact your doctor immediately. So we're going to ask you guys to stay home, self-quarantine, and immediately contact your doctor the following day, okay? We cannot, here at the fire department, we cannot recommend you get a COVID-19 test. We do not have the ability to do so. Currently in the state of Nebraska, the only person that can recommend a COVID-19 test is your physician. So that's why we ask you guys to please do that. Please contact your physician, okay? Now, so we've got two processes in that. So we've got the transportation process and we've got the self-quarantine process. Lastly, the last thing that we're going to speak about is if we receive a positive COVID-19 response. So if a patient contacts the dispatchers and says, hey, I have tested positive for the COVID-19 virus, we are going to then ramp it up a little bit more, and you'll see here shortly, okay? The process for that is the exact same way as the doorway triage. We will do everything the same. Whether you're ambulatory or non-ambulatory, we will treat this as the same, except for what we are wearing for our personal protective equipment. Assistant Chief Robertson here is going to step up and he's going to show you the difference between the two. This is what our EMTs will look like if we have a positive COVID-19 response, meaning somebody says they have been tested and tested positive. Chief Robertson has a tie-back suit on. You can see the difference. There's a tremendous amount of difference. He will have his gloves on as usual. He will be wearing a face shield. He also has goggles on underneath, and he will be wearing his N95 mask. It's very cumbersome. There's a lot going on there, but he is still certainly able to treat his patient as needed. It just may be a little bit louder. So, but other than that, I think everything will work just the same. If for some reason, thank you. If for some reason you are not ambulatory and we can't get you to the door to conduct our triage, we will suit somebody up just like Chief Robertson. There will be 2 of them and they will be able to handle that call. We will suit up 5 if need be, okay? We are going to take care of you, we promise. We are just trying to minimize our usage of this equipment because it is so hard to find. So we've discussed the 3. We've discussed the negative screening, which is kind of a lower level. Then we get into the mid-level screening, which we're seeing a lot of. We are seeing a lot of doorway triage. That doesn't mean all of them turn into messes, they do not, but it's just a level of safety for our staff and you guys as well. And then you've seen the 3rd level, which is the positive COVID-19 response, okay? All of that is basically just different levels of protection for you and us, the hospitals, and the community. The purpose of this video was just to show you what our response is, to show you that we are ready at each and every level. Our members have been fantastic. They have really taken a positive role in this and have trained constantly about this. So we are really pushing hard to really stay on top of this. We are constantly being updated by our medical direction, who we follow, with their responses to the changes. This is a very fluid situation, as you guys know. Each and every day you hear different numbers, you hear different rumors, you hear different things from it doesn't matter what news group you listen to. That being said, I would encourage you guys to please educate yourselves by utilizing the CDC's website, utilize the Department of Health and Human Services website, utilize the Lancaster County Emergency Management's website. Their information is spot on when it comes to what affects us here in Lancaster County, and especially Southern Lancaster County. MSNBC, CNN, Fox News, they're going to give you all kinds of information, which may be good for you, but please educate yourself in regards to what's happening here. And that's what we're basing our training off of. That's what I know our medical direction is basing their information off of. We get daily updates on this, and we're constantly evolving to make sure that our treatment for you is spot on. So hopefully this video helped you. This has been a wild ride for everybody. If you guys have any questions in regards to our response, in regards to anything with the fire department, please do not hesitate to contact me, Chief Robertson, Chelsea Brown, Julie Trippiati. There are so many folks out here that are knowledgeable in this, who have put the time in. If you have any concerns, please just know that we're ready. We've done what we needed to do, and we're certainly willing to ask or answer any questions that you may have. Thank you guys very much for being with us, and we appreciate you. So have a good evening.